Welcome back to Africa Science Focus, the weekly science and development show from SciDev.net. I'm Halima Athmani. In this episode, we look at one of Africa's most neglected tropical diseases, where treatments are in short supply, even though it blights the lives of tens of millions of women and girls across the continent. I'm talking about female genital schistosomiasis, or FGS for short, and it's having a profound effect on African society. Dr. Tijani Salami, a physician and sexual reproductive health expert, as well as founder of the Sisters Caregivers Project initiative in Nigeria, talks to our reporter, Michael Kaloki, about a disease which affects an estimated 50 million women and girls across the continent. FGS is a form of the tropical disease Schistosomiasis, also known as snail fever, because the parasites that cause it are released by freshwater snails. According to the World Health Organization, well over 200 million people required preventive treatment for schistosomiasis in 2019. Whilst schistosomiasis has been recorded in 78 countries, 90% of those requiring medical care live in poor, rural communities in Africa, where there is a lot of misconceptions surrounding the disease, even among healthcare workers.
A schistosomiasis that affects the female urethra and then the genital system. We have schistosomiasis that affect everyone, affect male, but female schistosomiasis affect the genitals. It affects the reproductive organ and also affect the genital organ. So that is what we mean by female genital schistosomiasis.
Dr. Salami, how is it diagnosed and what are the prevention measures, if any?
Yes, actually female genital schistosomiasis is highly overlooked and a neglected disease. I say highly overlooked because even in medical school, it is not taught. Anytime schistosomiasis is being taught in a medical school, where medical doctors or health professionals are being trained, it is the male schistosomiasis that is emphasized on. You cannot go back to any school curriculum, any medical school training curriculum where female genital schistosomiasis is mentioned. So that affects the reporting, the research, and the diagnosis. So as it is now, diagnosis is not something that has been really worked on for now. So what we do now is presumptive diagnosis. We look at the symptoms, evaluate the patient, and then have a high prediction that this patient is suffering from female genital schistosomiasis. Although now the WHO have come out with an atlas of diagnosis. The atlas of the diagnosis is that you are expected to inspect the vulva, inspect the vaginal area of the patient, of the female, look at the vulva and look at the cervix. And there is an atlas, there are pictures. But in this case, when there is a schistosomiasis infection, there are patches you are going to see. By the time you inspect the vulva, the vaginal area, or the cervix, so you are going to see some patches. And those patches have some resemblance for what you are going to see in the atlas that the WHO gave. So every health professional use that atlas to diagnose female genital schistosomiasis.
What are the prevention measures, if any?
We need to understand that the disease is not a sexually transmitted disease, because people that will be hearing when you talk of reproductive organ and all those, so their mind may be shifted that it is sexually transmitted. It is female genital schistosomiasis is never a sexually transmitted disease. It is acquired when a woman is exposed to water body, fresh water body that carries the parasite of the schistosoma. As the woman gets to fetch water, or as the woman is washing, doing a house chores, if he's using fresh water that has not been treated, so and the parasite is there, the parasite penetrates into the skin, and then from there it goes to the urethra and genital area, and then cause damage in those areas. Prevention now is to be able to provide potable and clean water, treated water. Once the water is treated, whether you are using it for bathing, you are using it for cooking, you are using it for washing, so and the woman will not be exposed to the parasite. So the prevention is provision of potable and treated water for women.
Why is it categorized as a neglected tropical disease?
Neglected tropical diseases are diseases that are not getting attention because it affects the poor. There are about group of 20 diseases by WHO, by World Health Organization, that is in this category, and then female genital schistosomiasis is one of them. It's neglected among neglected tropical disease. What I mean is that schistosomiasis is classified as a neglected tropical disease broadly. But when government want to intervene, all the intervention that has been going on, it will be targeted for male genital schistosomiasis in terms of research, in terms of diagnosis, in terms of treatment. Nobody talk of a female genital schistosomiasis. So among even the neglected tropical disease, it is also neglected. It's highly overlooked.
Why do you think no one is talking about it?
Yes, I think it's all about inequalities of genders and lack of funding of you see, because of the symptoms it presents, we have women that are coming with such symptoms that look similar like other disease. For example, symptoms of a vaginal itching or vaginal discharge, blood in the urine. Any physician or any health personnel, we think of pelvic inflammatory disease. That is what has been taking people's attention from the female genital schistosomiasis. So its ability to be able to know that this one is not a pelvic inflammatory disease, this is female genital schistosomiasis. That is the knowledge.
So basically, Dr. Salami, what you're saying is that it could be sometimes misdiagnosed as another condition.
Very well. It's highly misdiagnosed to be pelvic inflammatory disease because the symptoms are common. Yeah.
FGS itself is often misdiagnosed as a sexually transmitted disease, and of course, there is always a stigma that goes with that. As such, treatment for the disease is in short supply, and one of the big worries about FGS is that it makes women more likely to catch HIV. That's because it causes open sores, inflammation, and exposure to blood, giving easy access for any virus to enter the body. As a result, women and girls with FGS are up to 3 times more likely to acquire HIV, according to the non-profit SCI Foundation. It means that doctors and healthcare officials often lump FGS and HIV together when putting together action plans. But that is a problem, according to Dr. Ibrahim Rabiu, president of the Female Genital Schistosomiasis of Nigeria and lecturer at Gombe State University. He believes this approach could be spreading confusion among the public.
Could you tell me a little bit more about the stigma associated with this disease?
If you look at FGS, the clinical presentation is just like that of sexually transmitted diseases, and you know how how the society look at those that have such diseases. So the FGS is not known among the public, it's known among the doctors. So once girls and women presented with such, they will think that, okay, this girl is promiscuous. Even among married women, this married woman is involved in extramarital activities. Not know that this is not sexually transmitted diseases. It's FGS, which is not transmitted through sex. So this one give give stigma to those that have it. Not only that, marital discord to arise from it because they can't explain how come about this. So it's the stigma attached to it is a problem, giving the girls and the women a kind of depression and isolation. So we need with time, with our awareness creation, we hope to reduce this stigma and look at it the way it is, not STI.
What is the prevalence of this disease in Nigeria?
is an emerging public health that affects 50 million girls and women in Sub-Saharan Africa. It is a neglected gynecological disease that affects up to 70% of women affected with Schistosomiasis. And we all know Nigeria was ranked first in 2015 as has the highest prevalence of Schistosomiasis in Africa. And it is endemic in most of the communities in Nigeria. So, we don't have any documented evidence, but then if you look at it, there's no communities in Nigeria that doesn't have Schistosomiasis. And as I said, 7 out of 10 women infected with Schistosomiasis has FGS. So it's a problem in Nigeria. From the few studies I've seen, it has a problem. And then from the study I'm even conducting, it's a problem that we need to come together and do prevalence study to actually know the FGS body in Nigeria.
As we've heard, research into FGS is sparse, but data is slowly being gathered. Younger girls showed higher prevalence, whilst older women showed a pattern for cultivating cervical lesions early after infection as a result of shedding fewer eggs.
What measures can be put in place in Nigeria and the rest of Sub-Saharan Africa to effectively manage the disease?
Currently, as I said, it's an emerging public health problem, and even the awareness is too low. So, the measure we are hoping to put in place, because as I'm talking to you now, we are with the Federal Ministry of Health and also Federal Ministry of Education. The measure we need to do is that, first and foremost, we need to conduct, which we have started at a larger scale, a research to know the prevalence, to know the burden of FGS in Nigeria. Not only that, we need to build the capacity building of the health workers down to community level, which we have started in a smaller scale. And also, not only that, we need to continue creating awareness using available means, IEC, information, education, communication tools to reach out to the community people that look, this is not STI. It can be cured. And also, we need to also develop and then validate a simple diagnostic tool that can be used at point of care. And then availability of praziquantel is a problem, even within the mass drug administration. So we need to reach out to people to get this thing available all the time to treat FGS.
Doctor, what do you think are the consequences of neglecting this disease in Nigeria and to a wider extent Sub-Saharan Africa?
Yes, the consequences of neglecting this disease are many. It can be classified into medical consequences and social consequences. Of course, one of the medical consequences is that it leads to bleeding during intercourse, sexual intercourse. It can cause infertility and subfertility. It can lead to abortion and ectopic pregnancy. It can lead to involuntary urination when coughing, laughing, or even jumping. It can lead to genital ulcers, and the risk for HIV and human papillomavirus infections. That's the medical aspect. The social aspect, as I said, there is social stigma attached to it and embarrassment because it has the same presentation with sexually transmitted disease, and those affected try to isolate themselves and then fear of losing social networking, and they come up with a depression and feeling of shame.
If you want to find out more, head to the SciDev.net website. That's www.scidev.net. Today's show was produced by Harrison Lewis with editing by Ogechi Ekanyuanu and reporting by Michael Kaloki. I'm Halima Athmani. Until next time, goodbye. Africa Science Focus is produced by SciDev.net and distributed in association with your local radio station.